Hello everyone. Anyone who is about to get a septoplasty or a turbinate reduction surgery, either one of them or both of them together. Only key takeaway for you in this video is that get your surgery done from a well-known, reputed institute or a well-known ENT doctor. Mm, this is the only thing which I wanted to say to the people. Rest all, I'll be telling my own experiences. I've undergone two surgeries. Uh, the final conclusion for the people who are about to get the surgery done is these two things, that from a well-known institute, from a well-known hospital, and from a very good doctor. Don't consider this as a minor surgery. This is a very major surgery, and if it gets spoiled as it was spoiled in my case, it becomes very difficult to control and very difficult to manage. Uh, I'll be sharing my experience now. So I have undergone two surgeries of my nose. First was of septoplasty, which is to correct the deviation of the septum, and second was septoplasty plus turbinate reduction. It was two things combined, and there was one thing which was a minor thing to shrink the adenoid. My ENT doctor said that it is necessary. I have he said that I have a swollen tonsils and swollen adenoid, so he'll be cutting the adenoids in my throat. So that was a thing. So second surgery included three things, and the first was only septoplasty. And I underwent both of these surgeries in Raipur. My first surgery was done by a doctor named Surbhi Chopra. She is an ENT in Ramakrishna Hospital in Raipur. So she literally messed up my nose. She did a hole in my septum in my nose, which I didn't know just after the surgery. I got to know this after my second surgery. So my first surgery was done in March 2024, last year in March, and I didn't get any relief till 4 months. So before the surgery, my problem was that I had a blocked nose. I could not breathe properly, and especially through my right nostril, I could not breathe air properly, and uh, I had very severe headaches. I had headache all the time. I could not study anything. I could not do anything effectively or efficiently. When you have headache, you cannot. When you have headache plus when you cannot breathe better, when you cannot breathe properly, only you cannot do anything properly. So this was my problem, and after the surgery also this problem was not solved. So due to this reason, after 4 months, March, April, May, June, July, after 4 months, in the fifth month, August, I underwent my second surgery of septoplasty and turbinate reduction. So before the surgery, actually it is not recommended. When you have a hole in your septum, it is not recommended to perform a second surgery, because the only thing that will happen, no matter what, if your nose has blockage, that those things may be removed, but the serious condition is that if you have a hole in your septum and someone does a surgery in it, it will definitely, the hole will definitely get bigger. And the symptoms of the hole are that you cannot feel the air inside your nose. So when air goes through both of your nostrils, you feel it when it goes to the tip here, when it goes through the tip of your nostril. And if you have a this is called the septum, and if you have a hole in this, so the laminar airflow breaks. So the air goes here, it goes through the hole, then it goes through this nostril, and some part of the air is going through the top of your nose. It's very irritating and annoying. The normal pattern of the airflow breaks, and if the hole gets bigger, this thing gets more serious, and in my case the hole got bigger and bigger. So after the first surgery, I did not experience many symptoms of the hole, but after the second surgery, I felt little bit better in my blockage and headaches. Those were little less as compared to the previous times, but I you know this septal perforation thing started annoying me. After that time, after the second surgery, I could not feel the air, and the laminar airflow was completely broken. Actually, I have in my nose shape, the right side, the perforation on the right side is somehow bigger than the left side because mm because I have a different shape of nose. Everybody has a different nose shape, and it may be possible that the perforation which is on the middle in the septum, it may be bigger on the either side and smaller on the either side. So I have this case. So when the nasal cycle, which is when the left nasal cycle works, I find it very difficult to breathe. And when my right nasal cycle works, it is far better and easier to breathe. So as for now, how am I managing it? I'm managing it by putting a cotton in the hole, and my next step to improve or to correct this would be mm, inserting a septal button into the hole. So that is the only thing. Cotton gives a little relief, but because it doesn't get placed properly into the hole, because I place it manually, so uh, that thing is not the permanent solution for it. But when maybe I'll feel better when I get the septal button inserted. So this is my experience of my two surgeries, and again I'll say that please get your surgery of your nose. Especially nose is a very sensitive part of your body, and if something happens, it is very irritating and annoying. It literally hampers the way how you feel about your breath and about everything. It hampers, if it gets spoiled, it hampers everything in a way. So, again, I would say that please get a surgery done from a very good ENT or a reputed hospital. I would advise going to big cities like Bangalore, Delhi, Bombay, or Hyderabad. Okay, so I got my first surgery done on March 21st, 2024, and today I'm uploading this video on July 23rd, 2025. So it's been 1.5 years and the problem still persists. So that is why it gets very important for you to choose the right doctor. Um, it is actually very important to choose the right doctor, and do not consider it as a minor surgery. I'm not talking about the pain. The pain is manageable. I'm talking about if the surgery gets spoiled, it gets very harsh on you. In that sense, do not consider it as minor surgery. The pain is manageable. It is not too much. It is not. I would say it is manageable. I mean, you won't experience the pain obviously during the surgery, and after surgery also, the time will pass. It's actually 1 to 2 to 3 days. Yes, it's between my first surgery time was between 3 to 5 days to feel normal. Yes. And any more questions if anyone wants to ask, you can ask in the comment section. I'll reply to it. Okay, so I got my first surgery done on March 21st, 2024, and today I'm uploading this video on July 23rd, 2025. So it's been 1.5 years and the problem still persists. So that's why it gets very important for you to choose the right doctor. Um, it is actually very important to choose the right doctor, and do not consider it as a minor surgery. I'm not talking about the pain. The pain is manageable. I'm talking about if the surgery gets spoiled, it gets very harsh on you. In that sense, do not consider it as minor surgery. The pain is manageable. It is not too much. It is not. I would say it is manageable. I mean, you won't experience the pain obviously during the surgery, and after surgery also, the time will pass. It's actually 1 to 2 to 3 days. Yes, it's between my first surgery time was between 3 to 5 days to feel normal. Yes. And any more questions if anyone wants to ask, you can ask in the comment section. I'll reply to it.